Hi, I'm Tina Marks and welcome to the Domino Effect. Today we have a very interesting show for you. We're going to be going over to Desert Hyperbaric in Palm Desert and learning all about oxygen therapy chambers. These chambers, in case you've never heard of them, are amazing. They are beneficial to your health, whether it be preventative, neurological damage, stroke victims, tissue damage, post-surgery, even hangovers. Trust me, this is not a show that you want to miss. Have you ever wondered what your life would look like if only you could change the course of its direction? Well, you can if you change your mindset. You see, your mindset has everything to do with the decisions that you make, and it's these decisions that will create your destiny. This is known as the domino effect. In each one of our shows, I will be interviewing various wellness professionals that can change your life, personally, professionally, financially, and environmentally. All that is required is an open mind. Hi, Maria. How are you today?
Doing great, thank you.
Good. It's really good to see you again. How did you find Hyperbarics, though? I mean, how did you even hear about it? Because, like, I refer to Hyperbarics, I say, when people ask me, I say, well, do you remember the Michael Jackson chamber? And everybody can remember that, but otherwise, people say, what, a chamber with oxygen? I mean, people immediately relate when I say that. So, like, how did you get introduced to hyperbaric machines?
I was actually a patient. And,
oh, you were?
And what happened, I had a chemical peel, which was pretty dramatic on my face, and I wasn't healing. And my current silent partner in Hyperbaric, who owned the clinic back then, and who I knew socially, suggested that I try hyperbaric oxygen treatment.
Okay.
I had no idea what it was. I haven't even done any research. He gave me 2 free treatments, so I came to the clinic. I bought 5 more treatments. I was completely healed after my fourth treatment. I went back to work.
And that must have been really scary, because I've had chemical, but I'm usually like, come on, go deeper, go deeper.
Yeah, I was the
I'm
same.
not sloughing, I don't, my face isn't falling off.
Take it all out, yeah.
Right, but then I've seen, like, a friend of mine's mother who's, like, raw. I mean, the skin was like raw hamburger meat. That's what it looks like when you have those deep peels. And that is the danger of having something like that, right?
Yes.
Because you always just assume it's going to heal and it's going to grow back, and so that must have been pretty frightening for you.
And it literally did the miracle to me, the hyperbarics. Again, I didn't know anything about the treatment or therapy itself.
Had you tried anything else to speed along the healing?
Not really. No, I was just staying home and iced myself
and just praying,
just trying to live through it and go back to work when I heal. But it really healed me up fast, and what a wonderful concept for healing.
Yes.
Again, I didn't know a lot about hyperbarics back then on cellular level, how it works, but I just experienced the healing properties of therapy.
Interesting. So you had sold your business. You were probably looking for something else to invest in another business, because you wanted to do what you have your own business. It sounds like that, just like myself, and how that leads you into how your own healing leads you in a new business adventure. That's the domino effect right there, right? One decision, one good decision, another good decision, another good decision. Great. So you bought the company from, or you bought into the company? Is that what you had? Okay.
What happened is I was still working, doing my work for the other company, but then the owner told me that his plan is to sell the clinic or to sell the interest in the clinic. And I thought, well, I can probably really turn it around and market it and learn about it. That's how I ended up owning 60% of the clinic.
And how long ago was that? When did you buy?
It was in 2009.
2009?
Yeah. The clinic been in Rancho Mirage from 2001 through 2010. Then we built this facility.
Then you came here.
And we came here, which is obviously much better place for us, and office itself.
Right, exactly. Can you tell me a little bit about how it works and what kind of patients, it works best on? I mean, we know that for you, for the skin.
Right.
Why don't you go ahead and tell us how it works?
Let me just give you a brief introduction to what hyperbaric oxygen therapy is, and then our techs can go into depth explaining it.
Yeah.
So hyperbaric oxygen therapy, it's FDA and MAA approved medical treatment.
Right.
Where patient breathes 100% medical grade oxygen in a pressurized chamber.
Right. And in normal everyday life, I believe it's what, 20% oxygen, 80% nitrogen?
Yes.
Yes. Okay. So that's that. And this is 100%.
This
oxygen.
is 100% medical grade oxygen. And what happens under pressure, oxygen becomes soluble and it diffuses in all the body fluids and reaches the area of the body where tissues, bones, or nerve ends have been compromised.
Right.
Healing cannot take place without adequate level of oxygen. And through hyperbaric chamber, this adequate level is supplied to the tissues.
Right.
And
it almost like it combusts it through.
That's
it
exactly what it is. That's a great comparison.
The oxygen to the place that needs to be healing. Just, you know, and even, I understand, even like if there's obstructions, right?
Right.
Any part of your body that's maybe obstructed, whether it's an artery or something, it's with such force, that's why
it
you
saturates that area. There's a whole theory behind how it works, but we don't really need to go into molecular level.
Right.
So that's basically how it works.
Right. So what people would it work, what kind of infections, what kind of, you know, I understand a lot of tissue, right? Any kind of infection dealing with tissue. But I also hear, you know, strokes. I hear people with strokes can benefit from this if it's caught early on. Can you, is that again,
yes.
Is that the oxygen?
That's one of the indications for hyperbaric oxygen therapy. There are 15 Medicare and FDA approved indication, which is mainstream part of hyperbarics, and that includes crash injuries, carbon monoxide poisoning, like really critical indications, decompression sickness, radiation injury, thermal burns. I'm not going to go over that. What we see in clinic, it's mostly patients with non-healing diabetic ulcers, infections of the bones, compromised skin graft. That would probably be about 80% of our patients.
Yes, yes, and like burn victims. And you said radiation infection or injury. Would that be somebody
the radiation therapy for
cancer?
Yes,
that would be very good
that's covered as well by insurance.
That's fantastic, because I know that's very hard on the body.
It is.
Yes.
Additionally, there are so-called experimental or non-approved uses of hyperbaric, which would be neurological disorders such as traumatic brain injury. Hyperbaric are proven to help veterans or anybody who experienced that problem. Also, stroke. It can literally turn around the stroke within certain amount of time.
That is huge. That is so.
But it's very difficult to use, to implement unless you're in a hospital. With us being outpatient, one patient in the emergency room.
Right, because if they have a stroke, they're going to be in the hospital. Now, that's an interesting question. Do they have hyperbaric machines in hospitals?
They have a hyperbaric machines in actually hyperbaric clinic in on Eisenhower campus, but as far as I know, they only treat.
They would have to be transferred from the hospital over there.
Yeah, we don't have hospital-based hyperbaric clinic here in the area, but they're in Long Beach and other areas.
Okay.
They have a hospital-based clinics.
Right.
So we do treat patients with stroke, MS, Lyme disease. We also treat patients with sport injury after spine surgeries.
Spinal surgeries. Interesting.
In any kind of sport injury, it's gaining more and more recognition in the hyperbaric field how well it works to heal.
Muscle or bone, or
either
both? Or both. Both.
Yeah.
Okay. All right.
Another category of our patient would be those who had cosmetic or reconstructive surgery. We work with leading top plastic surgeons in the Valley. They see the benefits of the therapy. They see how healing is expedited, and they refer patients to us.
So you're just going to heal that much quicker.
Yeah.
Right.
Much quicker, yeah. And some patients, they have major surgery, and in a week they need to be at a party or a function.
And that can do that if they come in and like.
Depending on the surgery, I really don't want to, overpromise, but.
And how long is somebody in the chamber?
Depending on the indication, typical treatment for non-healing wound or any kind of tissue or bone damage, 90% at depth. So patients have to reserve 2 hours for the treatment.
2 hours.
For neurological patients, it's 60 minutes treatment.
60 minutes. And it's 2 hours, the 2 hours is the most that you can be in there?
That's the max.
It's the max, okay.
Yeah.
Is there anybody that shouldn't be in a hyperbaric?
There are certain contraindication to the therapy, and when you talk to our technician Dale and Carrie, they can go
answer
over
more
it.
of those questions.
Yeah,
okay.
But it's minimal. It's really minimal.
Okay. And you have how many chambers here?
We have now 2, and we have a room for a 3rd, so we're ready to expand.
Oh, fantastic. Oh, that's great. Okay. All right, well, let's go in and talk to the tech.
All
You want to answer more questions? Thank you so much.
Thank you, Tina.
Thank you. When somebody comes in for a treatment, does insurance cover it? Does PPO cover it? Does HMO, Medicare?
It is covered by insurance, and we accept most insurances. We have Medicare, United, Blue Cross, Blue Shield. We also accept Kaiser. We're contracted with Desert Oasis. Most of all the third-party payers.
Oh, that's fantastic. That's
Yes.
great news. Now, if somebody has an injury, would they be able to come in self-referred, or would they need a doctor's referral
They
for
can
insurance
come
to
in
cover it?
self-referred. What they would do is just call us and have their information faxed over to us from their attending physician, and then we would set them up to be evaluated by our medical director.
Okay, and they'll know on the spot whether they're covered by...
Certainly.
Because there's certain things that would be covered by insurance, but certain injuries that wouldn't be. Is that correct?
That is true.
Okay, so...
And with the medical records, through all that documentation, the doctor can evaluate and review them and see if there's a coverage there.
Okay, and what is the cost for somebody that doesn't have insurance?
The cost per treatment is $250 for our tissue injuries.
Now, let me ask you, how far in advance do we need an appointment? I mean, can somebody just come in, drop-ins, or there's only 2 chambers here, so I would assume that they're being used quite a bit.
We are booked, and the quickest somebody could get in is to call in and have their information faxed to us, and within a few days they could have their evaluation done by our physician and be in a chamber for treatment that same week. If it's an emergency basis, which we do have emergency patients, we can have them in that same day.
Oh, that's fantastic. Okay.
Everything's accelerated.
So it really sounds, it boils down to the paperwork. If everything's in order, ready to go, then you can go ahead and move forward then, right?
Yes.
Well, a hyperbaric chamber is 100% oxygen under pressure. The way it works, it takes you down to atmospheric pressure greater than the 1 ATA we actually live in. So
wait, excuse me, it brings it down to what?
it has the ability to compress a person's body down in pressure greater than the 1 atmospheric pressure that we live in. Okay. Hyperbaric chamber is a monoplace chamber, meaning single occupancy, can go down an atmospheric pressure of 3 atmospheric pressure, meaning 66 feet if you were diving in feet of seawater.
Right, I was just going to say that. I was going to use that. So it's like going down under sea level.
Exactly.
Okay, all right. And it's 100% oxygen.
100% oxygen full time.
Neurological patients and people that have infections, soft tissue, would, you know, there's 2 different treatments, right? There's different time levels for, like, neurological is shorter period.
Right, for neurological traumatic brain injuries, some of the neurological conditions that we do see, they have less time spent in the chamber because they go at a lesser depth. Because there's actually it's a brain accident, so they wouldn't need as much pressure in a hyperbaric chamber that a wound healing patient would need. So we would treat them at a more, what we call a more shallower depth.
Okay.
Opposed to treating a diabetic ulcer, a severe limb or amputation. Okay. That's furthest from the heart, that needs more oxygen and is starved of oxygen, so it needs more circulatory. I
see. Oh, that makes sense. Yeah. Okay, because it's further away from the heart, exactly. And that because the whole point is to force the oxygen to the place that needs to be healing. So if it's right in your head, then you're not going to have, so you're not going to, the pressure is not going to be as great, and the time length is not going to be as long either. But if it's a severe brain injury, I would think that you would need longer in the chamber, or just shorter periods of time but more frequently?
Well, just like a stroke patient, from the injury, a lot of times the neurons in a quadrant, one of the lower quadrants of the brain, has been damaged. So what hyperbarics does, at a low depth, it basically wakes up those neurons, and for them to become active again, to start to do their job. Unlike pressing them down, as we call it in hyperbarics, to say a 2.4, 45 feet level, we'd hold them at a more shallow depth, 12 to 17 feet, for them to get the benefit that they'd be looking for an actual brain injury, opposed to a wound that needs to be healed, that needs to be at a deeper saturation in a hyperbaric chamber.
Right. Now, I know this is kind of a general question, but somebody that does have like a traumatic brain injury, how many sessions would you think that would be required? Would it be 10? Would it be 20? I mean, what usually is the magic number? There's no
basic number we can put on. Once they start, protocol has it in thresholds that we look at. 10 to 20, we'd start out with a traumatic brain injury.
Okay.
And as we're treating the patient. They're getting evaluated. They may be doing other therapies in conjunction with hyperbarics.
Okay.
As well, maybe a special diet, maybe some occupational therapy, maybe speech therapy, that type. So we're basically monitoring their progress as they go along.
Right.
Everyone's different, so it's hard to put an actual number and say this is what's going to heal that injury.
James, what are you here for? Now, I understand that you had diabetes, is that correct?
I've had diabetes for 30 years.
30 years?
Yeah.
So do you take shots or?
I take insulin shots.
Insulin
every
shots.
day.
Mm-hmm.
It started with pancreatitis.
Okay.
So it wasn't like a genetic diabetes. It was,
how do you get pancreatitis?
Eating the wrong foods, drinking too much soda. I used to be a chef, so
You did?
I had like soda all the time.
Okay.
And I just got to the point where it infected my pancreas.
And is that curable after, if you change your eating habits and you start taking supplements? And
it started working again, but it came back online, and it was to the point where I was diabetic after that, because it's your insulin, it filters your insulin.
It's compromised,
yeah,
right? Mm-hmm. And then so you've had that for 30 years, and you've been kind of maintaining it, controlling it, so to speak.
Yeah.
But then you got a bone infection.
Well, the bone infection, I snapped my ankle with a toe chain when I was hooking up my trailer.
Okay.
The infection went into the bone, and now I'm trying to treat the ankle and the wound, because the bone came out through the side of the foot. So,
when did that happen?
July 25th.
Okay. So it's a really slow process in the healing?
The healing for a diabetic is really slow, yes.
It is, especially if you've had diabetes for 30 years. What have you tried in healing methods so far?
I go to the infusion center next door. They set the ankle with an apparatus.
So they place your foot in this apparatus, this frame, and is that painful?
Yes, very painful.
What does it?
It basically, when I snapped the ankle, it crushed two of the bones inside. So basically, what this is doing is holding the bones that are usable.
Oh, okay.
Or the bones that they can use that are sizable enough to, put back together. So it's holding it all in place, and it's aligned everything back up to where it'll stay aligned.
Okay.
And basically, it's until the wound heals on the side, which is where the bone came out. I have to keep this on here so that the bones all stay aligned.
That's penetrating the skin.
Yes.
It is.
It's inside. It's holding the bones inside the skin.
Right, inside the skin. So, okay, so now
It's got pins.
All right. So, and this is on permanently until it all corrects itself.
It's on for another 3 months.
3 months.
Yeah.
Okay.
And then if the wound heals in 3 months, then they put me in a walking cast.
Okay.
And then I'll be able to walk until they can fuse the bones that are there to, the bones won't permanently heal, and I won't be able to permanently walk unless they fuse the bones together.
Okay, and they're planning on doing that at another time?
Yeah, down probably like 5 months down the line.
So how did you find Desert Hyperbaric? And
I've been going to the infusion center next door since 2005, when I had my other foot problem. I dropped a starter on my foot with a truck starter.
I don't mean to laugh, but
I was working on a truck with open-toed sandals.
Oh no!
Yeah, and I dropped the starter on my foot, and it caused me to get gangrene in one of my toes, so they took the toe off.
Now, I do know by reading up on the hyperbaric machine that it is very good for gangrene. So did you know about the hyperbaric machine at that time?
No, I found out about it pretty much after it was too late to get into it for this other foot.
So you could have, if you'd have known about it, it could have maybe saved your toe.
It could have made a difference in saving my foot, because now I just have half a foot.
Oh, they took that much off?
Yeah.
Oh, I see what
they
you're saying.
They ended up taking half my foot off.
That's amazing.
So if I would have known about the hyperbaric chamber, it probably would have been able to save my foot.
Save the foot.
At the time when I found out about it, it was too late to do anything about it, as far as the healing was already too far advanced. But this time around, I knew about it, and I asked for it right away.
And you've had how many treatments so far?
I've had about 8 treatments.
Okay.
So
have you seen a difference?
Yeah, as far as the wound care person next door that does my wound care,
yes,
he says that there's a big difference.
That's fantastic.
This is definitely speeding up my recovery.
And how often do you have the treatments? I mean,
I have the treatments every day, 5 days a week, Monday through Friday.
And how many more are they scheduled for?
I've got about 6 more weeks to go.
Oh, fantastic.
So I'll be here for a while.
And insurance is going to cover it this time?
Yeah. Everything's being covered by the insurance.
That's fantastic.
So it all worked out.
In 2011, I had a knee replacement, and it resulted in a hematoma. And I had to have a wound treatment. And while I was having the wound treatment, I found out about desert hyperbaric medicine and asked my doctor if she thought it would help going for oxygen treatment therapy, and she did. So I came over here and had 40 treatments of the oxygen, and it was wonderful. It really helped my wound heal a lot faster than if I hadn't had it. Being a type 2 diabetic, you do have a tendency to heal a lot slower. So I was very grateful to Desert Hyperbaric Medicine. One of the nice side effects of it is your skin gets really soft, and it has a lasting effect. So I was really thrilled with that. So, and that's been over a year ago, and I'm healed, and I owe it all to the group at Desert Hyperbaric Medicine. They treated me wonderfully.
I'm 92, and I come over here to Hyperbaric Medicine and take the treatments. I saw what it did for my husband and how it improved his mind and how he could then carry on conversations with me where he hadn't been able to before. Besides healing his wound, it helped his mind. And I thought, that's the way to go. I can't think of anything better, and I'm going to continue it.
Now, is there anybody that shouldn't use, that could be a little bit dangerous going into a hyperbaric machine?
Absolutely, there's contraindications to going in for a lot of the COPD patients. You know,
COPD is what?
Chronic obstructive pulmonary disease. When you have lung issues, a lot of them may not be candidates for emphysema, that type, where the lining of their lung has basically been worn out. You know,
I read that, but that's what's interesting to me. I had to read that twice because emphysema, you would think pure oxygen would be great for your lungs. Well, because you see people walking around with an oxygen tank.
Yeah, that's low dose, 2 to 6 liters of oxygen that they're breathing from a little oxygen tank. Well, you're going into a hyperbaric chamber that fills with 450 liters of 100% oxygen, and then it's pressurized. Yes. So that's the difference in getting nasal cannula opposed to going into a saturation of oxygen.
Okay.
Meaning the diffusion rate that's taking place in the lungs is a bit different in a hyperbaric chamber opposed to what they're getting from an actual breathing canister or from 6 liters of oxygen.
Right.
So it could become toxic for a patient that had major breathing issues.
Okay, and if somebody that doesn't have any kind of breathing issues, do they feel any kind of pressure in their lungs when they're in the chamber?
Well, it's no feeling of heaviness on your chest. There's no difficulty in breathing. The air's not thicker in there. It's just you're breathing normal like we are out here, but you're getting a full saturation opposed to we're living at 1 atmospheric pressure that we're breathing 21% now. You're getting high doses of oxygen in the chamber, but you're not feeling any kind of different effects of breathing. It's the same breathing in here. The only sensations you really feel in the hyperbaric chamber is the inner ear pressure. And that's like being in the cabin of an airplane or driving up into the mountains. We yawn, pinch our nose and blow.
Well, now, so do people use this as a preventative medicine, or
Absolutely.
They do? So they come in even if they don't have any kind of injury or anything?
We have overall health candidates, patients that come in that's taking control of their own health, holistic medicine, that in conjunction with a lot of the vitamins, the alternative medicine that they use, they may come in for hyperbaric chamber because they feel like it's a detox. Hyperbarics is also a detox where it pushes the impurities out of your system as well. So it's good for that as well. We have some patients that may come in as a patient for whatever we're treating them for, and then they come back and they continue for years.
They continue on because
come
they
back
want
2 or 3 times a month and call it an overall tune-up.
So that's how many times you would probably be needed, only 2 to 3 times a month.
Well, it depends on the person. It's not.
Can you overdo it?
Well, with hyperbarics, overdoing it would be if we're treating a patient. Well, you wouldn't be able to sleep in a hyperbaric chamber, but at the same time, that was put out years ago that a certain person was sleeping in a chamber, but it didn't happen. 100% oxygen is toxic. It is a drug that's administered at high levels. So that's why there's protocols and time limits to be in a hyperbaric chamber for treatment.
Right.
So anyone going over the 2.5, getting close to a 3-hour time limit, it becomes toxic because it is a drug.
Yes.
So we have no one that I've ever heard of in all the years I've done hyperbaric that sleeps in a hyperbaric chamber. It's just not possible.
you know I had to bring it up.
Yes.
And because everybody else wants to know.
That's right.
I was saying earlier,
Yeah.
everybody, that's how they identify with the machine. So, so can you tell us a little bit about these particular machines? I mean, I know there's probably all different brands. Are there several different brands?
The main players on the market today would be Medical hyperbaric chambers and basically Seacrest. There's a few others out there, but Seacrest is basically what we consider the Rolls Royce of hyperbaric chambers.
Which is what you have.
We have 2 monoplace chambers, Seacrest. There are newer models that came on the market a couple years ago, a little bigger, and we won't call them better. They're bigger. They all do the same thing, compress you down atmospheric pressure. They have the capability of going down 66 feet if you were diving in feet of seawater.
Right.
And Seacrest is a good maker of chambers. They're located in Anaheim, California. That's where the manufacturing plant, which you can call, and they'll give you a tour on how they're made and what it takes to make a hyperbaric chamber. But if you find most facilities like ours, which is considered a standalone, and hospitals, they have Seacrest chambers. I say 75 to 80% of the market share is Seacrest chambers.
It is.
The popularity, most people that call, they ask what kind of chambers are there. They have a namesake in hyperbaric chambers because they were one of the first that was on the market making chambers. So they've maintained a good standing, very safe, safety record, basically impeccable in this country, and they're used in several other countries as well. So Seacrest is highly recommended and highly asked for.
So let me ask you, is it good for a hangover?
Yes.
You're talking about detox?
Yes.
I got to tell you, Patrick, my camera guy had
worked with
asked
guys
me that
has
question.
come in Monday morning and went straight into the chamber, and it's amazing.
No, really?
Absolutely.
Oh, good question
Absolutely.
then.
Never did it myself, but they are used
So
for
are you open
it.
on Sundays then? No.
No, we're not open on Sundays for it.
Maybe we could be getting a request, right?
Exactly.
Okay, well, thank you so much, Dale, for being with us and answering
Very
our
much my
questions.
pleasure.
And thank you. So you can see by today's show what an amazing impact that these oxygen chambers have on your health. And when your health is compromised, you're compromised personally, you're compromised professionally, and you're compromised financially. So if you get your health back on track, this will create a positive domino effect, not only on your health, but personally, professionally, and financially. That's the domino effect here. If you'd like to be a guest on the show, please contact us at this email. Thank you for being with us. I'm Tina Marks.